Hello, everybody. My name is Matt Perry, and I'm the CEO at the Genesis Healthcare System. And with me today is Dr. Scott Wegner, and he is the Chief Medical Officer for Genesis. We decided to do this recording and do this video, especially for you, the members of the school boards of our region. After we had a meeting on this Monday with all the superintendents in the region. Today is Thursday, September 23rd, and we wanted to do this as a follow-up. So we asked to speak with the superintendents to discuss the situation with COVID and how important it is for the schools and the health systems to work together on some of our mutual goals, because we really do have overlapping goals. I know that you and we very, very much want to have our kids in school, consistently in school. And I know everybody wants the healthcare system to keep functioning and functioning effectively. And so, our goal obviously is to be able to treat, as a health system, is to be able to treat all patients who need our care, whether they have COVID or not. And so I wanted to ask Dr. Wegner to start by sharing some information on kind of where we are with COVID right now in our community. Dr. Wegner?
Sure. So right now, today at Genesis, we have 72 patients hospitalized with COVID, 18 patients on ventilators with COVID, 23 of our 24 ICU beds are currently occupied. In our region, which includes 17 hospitals, as of this morning, there are only 5 available critical care beds among 17 hospitals. If we wanted to transfer a patient, that would be very difficult because the tertiary centers in Columbus and Cleveland have waiting lists, more than 50, in some cases 100 patients waiting for ICU beds. Additionally, we have currently more than 60 nurses that are positive for COVID, and another about 25 or 30 that are out on quarantine. So we're in a very difficult situation in terms of capacity at the moment.
Yeah, so with 72 patients in the hospital, we are absolutely, completely maxed out as an organization. We have all of our beds open. Our staff are working insane number of hours, and so this affects not only patients who have COVID, but it affects every single person in our community who might need our care. So one of the things that that with so many COVID patients in the hospital here, how have we prevented, and we work very closely with them, our whole big huge staff works very closely with them, how have we prevented spreading COVID amongst ourselves? Dr. Wegner?
Right. Now, first, Matt, I think it's important that we talk about openness and transparency. I've been a cancer doctor for almost 30 years, and 30 years ago, I made decisions for, say, a patient with breast cancer with the best information that I had available at that time. And when I look back at some of those decisions today, with today's knowledge, some of those weren't the right decisions. And we are in a similar situation with COVID, where we've learned everything that we know about this disease in an 18-month time span. Some of the difficulties, the differences rather, is that in my cancer career, the knowledge has been gained over 30 years, and most of my decisions have occurred in the privacy of an office, known only to the patient and myself. Every decision that we make regarding COVID is immediately dissected by social media and others, and some of them have been interpreted as that we're lying to them. In fact, what we're trying to do is make the best decision each day with the information that we have available. At times, we've missed the mark. Say, for example, early on, we felt that the best move was to keep kids home from school, and that turned out to be a decision that had great costs. Now we understand that it's so very important to have children in school, but there is a great cost to that decision, as well as we have, as Matt will describe, many, many children infected.
Yeah, and so one of the biggest things that we've learned, we want to just share what our experience is that masks work. They work to keep the prevention of spread of this disease amongst a group of people that are working or being in school together. And they really only work when everybody does it, because my mask protects you, your mask protects me. And so that learning has been built over the last 18 months, and we just wanted to share, what we know as fact to work. We also wanted to share some additional information with you. There's a graph that's coming up on the screen now, and this is the total number of cases. Now, these are not hospitalized patients, but these are people who are confirmed cases of COVID, going back in July, August, and then September. And it's broken down by age category. So I'm going to start all the way over on the left-hand side of the graph. So you see in July, there were 11 confirmed cases, and this is just from Muskingum County, but this is also this data is very, very similar from a trend standpoint for all the other counties around us. So back in July, we had 11 cases for people 0 to 19. For kids in August, for 0 to 19, that jumped up to 255. In the first 17 days of September, the 0 to 19 cases jumped up to 661. So this, as you can see, is this is being spread dramatically in the younger age population, and then those folks are taking it home and infecting others. So, Dr. Wegner, at the beginning of this, we didn't think that it really spread amongst children, right?
That's right, and that's another example of how our knowledge has changed. It was initially felt that the children were carriers and were unlikely to be transmitters. That's not been proven to be true in Delta, and we have countless numbers of cases where the index case, that's the person who brought the infection to the hospitalized patient, was a child coming home from school. And it's understandable that most people think, hey, my kid's going to get sick, he's going to get better, very little chance of something bad is going to happen to them. And for the most part, that's true. However, the flip side of that coin is those children are taking the infection home to households where there's often multiple generations of patients or household dwellers, some of whom aren't very healthy, and that's who's in our hospital right now.
Yeah. So how did this happen? It's a combination of really two things. We had the Delta variant arrive in our community in August, and you see those numbers from that graph. And then what else happened? Well, school started. It's a combination of school starting and the Delta variant is given us the situation we are in, because the vast majority of students are in school right now in our region without masks. So we're not using masks as the one tool that we know to be able to keep kids in school and keep it from spreading. One of the things that we know is a huge issue for you, for us, for all of us, is the political pressure. We know that you guys are under an enormous amount of political pressure from a group of people that are very against masking. We're not judging them, but we do know that it is that a disproportionately small number of people can create a huge problem. But we wanted to make sure that you understood, kind of what the reality on the ground is in our community. Right now in the state of Ohio, 58% of the school districts that are of the kids that are in school are in schools that have a mask requirement. And those schools that have a mask requirement are seeing dramatically lower spread. So what we're asking for your help with is we're asking for your help in getting the kids and the staff in schools to wear a mask, at least to start with. And we'll talk about that more in a second. So I wanted to first of all share an example right here from our local region in Morgan County. So Morgan County had before they put a mask mandate in, which they started their mask mandate a week and a half or so ago. They had 400 cases. So we had 400 of their kids that were out on quarantine. This was before the mask requirement went in, and they had 33 cases of COVID. 1 week after the mask mandate went into effect, and they were all wearing masks, that went down to 92 kids out on quarantine and 11 cases of COVID. it makes that, and that was only 1 week. So, and it's going to get better over time. So, one of the things is, as you're considering, what you're going to do, one possible way of doing it is, and some of the school systems are doing this, is to start with 30 days. Let's put this on for 30 days and then track your numbers and see how effective it is. And then we'll see how prevalent the disease is in the community. And this is not a forever thing, but it is a huge thing to reduce the number of people that are getting sick. So, whatever would work for you, we want to be able to help in any way we can. So to that end, we wanted to, you'll see up on the screen, Dr. Wegner and my contact information. We're willing to come talk to you or anybody in any way to share this information. We all want our kids back in school. And we all don't want the healthcare system to break. And I want you to know the healthcare system is very close to breaking, and not just ours, but throughout the entire state. It's happening right now. I mean, I've seen cases and examples in other parts of the state where patients are having really bad outcomes because the hospital just can't care for them.
Matt, can I share a couple of examples of what's happening locally?
Please,
sure.
Please.
So a week ago, we were in a situation where we had 5 patients who needed emergency coronary bypass surgery. And unfortunately, at the time, we had no beds to put them in. And a patient who has that type of surgery needs an ICU bed. So we literally had to make a decision which patient is most likely to die and put them first on the list. Fortunately, we were able to get one patient operated on within a day or two. We were able to get one transfer to another institution, although that was a miracle because every place had a waiting list. And 3 others have been kept in the hospital waiting for us to have the opportunity to do their emergency surgery. Another more personal example, I would like to share a rather poignant email from one of my colleagues on the floor. This is a physician wrote this to me. My 70-year-old unvaccinated patient is dying of COVID today. Her great niece brought it home from school. The patient's daughter is her power of attorney and primary caregiver and is also hospitalized on a different floor, also with COVID. The daughter gave me permission to see her in her room so I can have a face-to-face visit about her mother's rapidly declining situation. The daughter wants to make a goodbye visit, but she's on 100% oxygen, and her oxygen levels are dropping anytime she talks, cries, or rolls over in the bed. After sitting with her for a while and coordinating other ways she can say goodbye to her mom, I ask her if there's anything I can do for her, and she says, "Can you tell me how my husband is doing? He's in the CCU on a ventilator with COVID." Now, as a longtime physician, I can tell you I've never been in a situation where I've had to ration care, and you don't need too many of these examples as a physician and caregiver to make you realize we have to do something different.
Yeah, it's those examples. I think that's where we're at, and so it doesn't only affect people who have COVID. It affects everybody for any type of care. And that's why we're coming to you with a very sincere request. Please help us with this, and we'll help you in any way we possibly can. We really appreciate any thoughts and ideas and actions that you all can take to help. Thank you so much.